I think the Digital Academy is really, really important because without the workforce that's got the digital knowledge and skills, and I include in that the leadership skills, the skills in clinical change, and the expert knowledge about data science and leading technology changes, we can't transform our NHS. We can't transform the way we work. And as we've seen in the COVID pandemic, you know, there's a real advantage to working with digital technologies. It can really help us to change the way we work, to deliver the long-term plan, bring care closer to patients. Things have fundamentally shifted, and now more than ever, we need people with the knowledge and skills to lead that change and to consolidate what we've done thus far and take the best of it and think about the what next. So the Academy is particularly good at developing leaders for digital change, and it's really important that we have those from all clinical professions and from other professional groups who work daily in delivering healthcare. I think it supports in a number of ways. Firstly, obviously with the content, so the very carefully considered content to make sure that people do have the requisite knowledge and skills to lead digital transformation. But importantly as well, I think it's about the community and the network that's built, and that goes way beyond that learning and well on into people's careers. If I think of my own experience of doing a scholarship, so I did a Florence Nightingale Leadership Scholarship some years ago. To me, I describe that as the gift that keeps giving, because even now I still feel the benefits of that and still reach out to the people that were either in my cohort, in other cohorts, or I was afforded the opportunity of connecting with through the programme that helped me in my day-to-day work. Nurses and midwives make up a third of the workforce, so it's fundamental that they're there. I think when digital transformation is done well, we consider people, process and technology. That means having deep expert knowledge about the work that you do and then how technology can support that. Nurses have been underrepresented in this space, and so often it's commented on by nurses and others, we see it in practice, that they're digitally done to. They end up with change that doesn't really help them do their work. And that's bad for nurses, it's bad for patients, and it's bad for everyone, because ultimately we find we have a problem with adoption. So we are going to need lots of nurse leaders who are able to articulate what nursing does, bring that specialist knowledge together with the knowledge they get through a programme like this to lead the profession forward with others. And we definitely need to do that with others. This is about bringing everybody's collective individual expertise to the challenges to make it work. So they get to be part of a community of digital leaders from all sorts of professions, doctors, AHPs, informaticians, and operational managers, all coming together to learn together, to go back into the workplace to make a difference for our patients.